Welcome to The Way Forward, the podcast that dives deep into how technology shapes our health and well-being. From digital wellness to tech innovation to the effects of electromagnetic fields, we cover the environmental, social, and physical implications of technology. Ready to navigate the digital landscape with confidence? Set your dial to discovery and tune in. You're listening to The Way Forward. Dr. Jill Carnahan, thanks so much for coming back to The Way Forward. I'm so glad to be here in your office.
I know. It's so fun to have you guys out here in real time, and it's like in person is so much more fun.
Thanks for inviting us out. And we're here, guys. The reason I'm here is because Dr. Jill just made her clinic the first EMF-friendly clinic in the world. Mm-hmm. I think that's safe to say, in the world. Yeah, that's amazing. So I want to talk a little bit about what you do here, because I know if you guys go back and listen, I think it's episode 8, and it's like the mind-body balance, I think is the title of the episode we did together. And you told a little bit about your story, which we can get into more because you have an incredible story. I'm like, I could hear that story 20 times and cry every single time I hear it. But we didn't talk so much about what you actually do here in the clinic. So can we start there of like, what is the space and how long have you been here? And
I'll make that short. But I started, went into medical school kind of wanting to do holistic medicine. I grew up on a farm. We had organic produce. My mother was a retired nurse, was retired to raise 5 of us children. So there was a lot of things that shaped my childhood as far as believing that our bodies had the potential to heal, believing that the right inputs would matter. And so I literally went in thinking I was going to do physical therapy, osteopathic medicine, acupuncture, chiropractic, like some allied health profession that wasn't traditional medicine, because those were the kind of things I grew up with. And what happened was at the end of undergrad, I did a bioengineering degree and then was applying to these schools. And I was like, what about medicine? You know, it was almost like an afterthought. And I'm framing this because it's so interesting. People are always like, did your journey frame your type of medicine that you practice, or did you go in with it? And I always like to say I kind of accidentally infiltrated the system. And what I realized was, at the moment, still true today, 20 years later, the allopathic medical system, MD-DO, is still the best reimbursed system. So for most people to get scans or images, or if you have a heart attack or a stroke or a car accident, you want to go to a major medical center. It's just the best place for acute trauma or illness. It's not the best place for chronic illness. And so that's the difference. But what ended up happening is I went into medical school and started to see the great things about it, like a good differential diagnosis, ruling out cancer or serious illnesses. But then the deficiencies were with our complex chronic diseases, obesity, diabetes, heart disease, autoimmunity, immune issues, and all the weird, strange things. We don't do a great job in general. So from that instance, even in medical school, I was like, I want to do it differently. And what if I could take this great information and build a bridge between conventional medicine, doctors that are doing their very best to be rheumatology, neurology, gastroenterology, and also bring in this other way, which is, how do we find the root cause of an illness and actually reverse that trajectory?
Okay, so that's really interesting, because I feel that many stories are opposite. It's like we grew up in this specific way. We were going to go this, the allopathic way, or the mainstream medical way. And then they get, the trajectory changes because of something. Which is like what my mom went through, we were talking about. But you kind of were opposite. It was like, I could build the bridge the other way. Where it was like, I grew up understanding, you grew up understanding like the holistic side a little bit more, it sounded like. And then you were like, oh, but I could build this bridge. Normally it's the opposite. Do you know what I'm talking about? Like most doctors, it's like that are practicing functional medicine or holistic medicine, it's the opposite. They start there, and then they try to build the bridge over the other way. So
or they find a problem or illness where they can't. Even my colleagues who, at the time when I was in med school, I was the first, it was Loyola University, and we created the first integrative medical, it was like a club. Every month I would bring in speakers, like a massage therapist, a chiropractor, other professions, so that the students would get exposed to these other professions and have some respect, so that we could start to collaborate. That was like literally in med school. I started that first of its kind in that setting, to introduce these concepts. And it was really, really neat, because I felt like even at that moment, I had this vision of like, how can we bring these two together? And always what I've tried to do in my practice here, and every place I've ever practiced, is how do we do the very best science, even if we're doing stuff right now. When you have an implementation of a drug or a procedure or something, it has had like 30 years of research until it's actually considered standard of care. So what that means is, if there's a brand new We just talked about this kinds of hydrogen machines or some sort of device out there which has data or doesn't have data. It may take 30 years of the science to catch up with when we implement it in clinical practice.
Mm.
For functional medicine, we are right on the bleeding edge. We're saying, hey, if there is very little risk of giving IV vitamin C for antioxidant status or whatever issue that might be, and I'm just giving that as a random example, we might implement that very soon after the first few studies come out and show safety because we see the potential benefit. So we're on this cutting edge of trying to implement things that are evidence-based, very low risk, but maybe don't have the 30 years because who wants to wait 30 years? And nowadays things are moving at such a rapid pace.
Yeah, and the very low risk thing comes in because
Yeah.
I was just talking about this earlier with Josh actually about how we kind of have this like safe until proven harmful approach with the United States. Like, you know,
Yeah.
all of these other countries have a lot more research. Russia, Italy has a lot more research on EMF, for example, and they have a lot more strict guidelines and
yes.
restrictions on what they do at schools and things like that. But here it's kind of like we just do it until we know, you know what I mean? And we say these things like, oh, well, there's no science behind it, so we'll just keep doing it until. So it's like, I see what you're saying. And then I think we do the other thing as well, where it's like, we don't use our own common sense. We keep using this idea or this just phrase of like, oh, well, there's not enough science to know if it's harmful, so we're just going to keep doing it. And I'm like, but if you just think about, you know, EMF is the greatest example because if you just think about what it's doing to your body.
Right. It's obvious.
It's obvious.
I love that you said that because even just on the way here, I was on a conversation with a friend and they're like, is there any evidence of that? I'm like, are you kidding me? I mean, it's all European. It's outside. Like, granted, there is some evidence in the US, but like a lot of the studies and a lot of the great science that I read started outside of the US. Like a lot, they're way ahead of us.
I mean, think what you want about Russia, but Russia has the longest standing research on EMF.
Yeah.
They also have some of the strictest guidelines and restrictions on it. So yeah, that's really interesting because I like what you're saying about low risk of like, hey, the just in case method, that's actually how I found Aries is I was like, I'm a just in case type of person, you know? I'm like, I don't really understand the science at that point. I really didn't understand the science, but I was like, why not? Why not? You know what I mean? It's such a low risk and the probability of good is so high. Yeah. And I'm not just going to sit here and wait and find out what the effect is on my children, which I think is where most people have that shift of perspective. It's like, I can do the whole like out of sight, out of mind thing until all of a sudden I have a baby in my hands. And then it's like, okay, I see that white raw ratter over there in the corner. And like, what is that doing to my baby, you know? But yeah, so when you're in the clinic, what are you really seeing? Like, how long have you been practicing medicine?
24 years, maybe.
Okay, so 24 years. Have you been here?
No. So I started in Illinois after I graduated from residency, did family medicine for several years, and then built an integrative medical center with a hospital. Okay. So that was my first, and really creating safe spaces started there because I started thinking about how do we create a clinic. I literally sat down with the architects of the hospital and built a clinic from the ground up and thought about how do people feel when they walk in the door. So that was the first. And I was there for 3.5 years. And then I moved to Colorado, worked with Bob Roundtree for a bit. And then I've been in this clinic since 2015, so 10 years.
10 years. Okay, so I'm really curious from when you started practicing medicine, so much has changed. Like when you got diagnosed with cancer you said 25. It was like a couple days after you turned 25, right?
Yes, it was literally.
So I remember that. I'm like, I can imagine 25, I just had a kid. And but that was so uncommon at the time that you got diagnosed. So since then, what do you see now? Like, what's the change with all the environmental toxins that we're being exposed to every single day? What have you seen change from, your patients?
Yeah. So it's interesting too, because even though I was very aware and very holistic minded and kind of came with this mindset of bringing the conventional into the new, more holistic minded stuff, the cancer was a real wake-up call because no one thinks in their 20s they're going to get a life-threatening illness. And at the time, it was like horrific. I thought, I might die. I didn't know. Now, looking back, of course, I'm okay. But and I had to do very, very aggressive 3-drug chemotherapy, radiation, like everything they could throw at me, they did. And it was almost to the point of like, I was so non-functional after all the treatment. But all that to say, that experience ended up shaping everything that I do today because I went from doctor to patient and had to understand, first of all, the complexity of making medical decisions. We think it's black and white, and it's not. I had thousands of journals that I had to go through and figure out, what do I do? And there's no protocol for a 25-year-old with aggressive breast cancer. The likelihood of that would have been like the likelihood of me winning the big lotto. It was like such an abnormality. And at the time in that medical school, I was the youngest they'd ever diagnosed. Now, sadly, you said what's changed since then. There's been 16, 18, 24, like lots of young women more than ever before, because our environmental toxic load is increasing exponentially. And you alluded to this fact before. We think that the EPA and that our government protects us, but they are not testing chemicals synergistically. And we have not just one exposure, but we have thousands. And then they're also not really testing some of these low-level things like hormone disruptors have a profound effect at very tiny doses. So say the milk that you drink is not organic and there's hormones laden in that, a small young girl could drink that and have precocious puberty because she's getting hormone from the milk. And I could go on and on and on with things. Your question, though, what's changed? Back then, you'd see someone for hormone replacement and menopause or thyroid disorder or maybe a new autoimmune disease. You'd fix their gut, and 6 months later, they'd be great. Nowadays, the layers and levels of complexity.
Got your work cut out for you as a doctor.
It is so much more complex. And
Yeah.
most people do not get well in 3 months or it takes longer. The toxic load is greater. And again, EMFs are relevant because in that toxic bucket is parabens, phthalates, heavy metals, chemicals, nanoparticulate from the exhaust of the cars, the air that we breathe, the water that we drink, the food that we eat, and these invisible things called EMFs that we don't even know. Unfortunately, you and I know what they are, but many, many patients don't know. They just know if they're in a dense Wi-Fi city, they don't sleep well. Or if they're in a certain area with incredible high density, or maybe the wiring isn't properly done, they might have heart palpitations. So there might be something that they can tell physically, but they don't know why. And so it's this load analogy of we're all drowning in toxic soup. We don't know why we don't feel well. And Josh earlier, when we was talking about how people don't even know they don't feel well, right? I always, even when I'm starting to help someone on their path, what I want is for their first visit back to me, we made 1 or 2 interventions and they come back like, I'm sleeping better, I feel better. Because until you get out from under that, what's the norm? You wake up with achy joints, you wake up kind of brain foggy and tired. You think that's normal.
Oh, 100%, especially as a mom.
Yes.
Especially as a mom. Like, I didn't realize how much whenever we had mold exposure, how much that was affecting my mental clarity. I just thought that was motherhood.
Right.
I was like, I'm just tired and foggy all the time. Apparently that's motherhood. And then when we got out, I started like getting myself back, and I'm like, oh, like I can be a mom in myself too, you know?
Right.
Like, I can feel like a whole person. Yeah, that's super wild. So you're seeing a lot more of what used to be anomalies.
Oh, yeah. So more, complexity. So at the core of functional medicine, I always think of it as toxic load plus infectious burden. And those two things, and we can define real quickly what those are, but those two things interplay to create immune dysfunction and inflammation. We saw this during the pandemic. It was a great way for the public to be educated because all of a sudden you're hearing cytokines, which most people didn't know what those are. Those are immune modulators that create inflammatory. And most people say after they got COVID, they would actually, if they were to get sick or to die from it, God forbid, it was because of the immune inflammation, not from the virus itself. And that's often what happens with these old dormant viruses, infections, and things in a toxic world. That toxic load is suppressing the immune system so that old things, like maybe you got bit by a tick when you were 4 years old and it never bothered you, but then all of a sudden Lyme pops up because immune system's weakened due to EMFs and toxic chemicals and poor food and poor water and poor environment. So those toxic load suppresses immune system. Old dormant infections reactivate. And at the core of most of what I do, whether it's neurodegeneration, cancer, autoimmunity, or other things, is toxic load, infectious burden. And I have to figure out which of those things are playing into there.
And like history.
Yes.
Like, always talking about what we do with our kids right now will affect them for the rest of their life. What we're doing, what we're eating, what we're consuming, the environment that we're living in. It's not just how we're going to feel today.
Right.
It's how you're going to feel 10 years from now with all the other things that you were around. Quick break in the episode, you guys, because I got to tell you about the amazing sponsor, Aries Tech. Aries Tech creates cream of the crop, top of the line EMF protection devices that do not interfere with your signal, but all of their technology is actually backed by peer-reviewed, patent, and published research that has been going on for almost 20 years. They were originally funded a couple decades ago by the military to create a medical device that would help protect men and women who are working on radio signal towers without interfering with the signal, and have since become a consumer product as we have become
become more of a technological world. They're also used by professional athletes like Tiki Barber from the NFL Giants and Macy Barber from the UFC for performance optimization tools. You can go to their website, ariestech.com, and check out some really amazing studies where they've done some EEGs to show how these devices are affecting your baseline brain activity. It's really, really cool. I personally have one on me right now near me because I have my phone, my computer, my camera, everything going on all at once in an office building where everyone has their own Wi-Fi. So I don't mess around. Check them out, ariestech.com. Use code INTUNE, IN-TUNE, TUNE 30 for 30% off your entire order.
I interviewed someone named Mike Bender. Have you heard of him? Okay, so he had that exact thing happen where your analogy with the toxic bucket, I love that analogy, and it's the best one out there, I think. But that's what happened to him. He had mold exposure. It kickstarted Lyme disease that from a tick that he got when he was 9 years old. I think that's the right age. And then he's a screenplay writer, I believe. So he couldn't even like put his fingers onto a computer. He would know when his wife had her cell phone on in her pocket. She did an interview because he found Aries later on, and I love his story. And she did an interview where she was like, I'm not even kidding you, it saved my marriage.
Oh, yeah.
Because there was so much like where he was seriously so sick. And his story is so interesting because he didn't really believe in all that stuff. He was really trying to figure out what is going on with me. Why am I he's getting heat and he's feeling. And so he tried all of these different blockers. He would put the gloves on. And then when he had the gloves on, he'd put his hands on the computer and then the signal would go up his arm. And so he really explained to me why he believes a lot of like the blockers and stuff don't work. But he had that same thing where it was like, all of a sudden he's just complexity, the complexity of the sickness he had. It was really difficult to identify what was actually going on. And there's so many people like that right now where they're going. I have a friend who's seen 4 different doctors. They're all telling her she's fine. They're all telling her she's like giving her the same test. And she's like, what is going on? So people like you, I think, are so important in the world right now who have that deep understanding of like the history and how that plays in to this toxic bucket and the overflow and all of that. So I want to get into it when someone comes in here with complexity like that, where you're just like, there's no way for me to fully identify at this very moment what's going on, because clearly your immune system is just out of whack. Where do you start?
Yeah, so you mentioned it, and it's really listening very carefully, good history, because often I'll say, when did you last feel well? And they'll say, oh,
That's a good
2018,
question.
right?
Yeah.
And then there's a timeline. In my mind, I'm creating a timeline or trajectory of from birth all the way till today. And I'm in my mind as they're talking, I'm literally pinning the points on the timeline. And here they felt well, and here they did. I'm like, okay, what changed? Did you move? Did you change environments? Did you have a stressful event? And so I'm asking the questions as they're putting their timeline. They're just telling me their story. And I include in that, were you born by a C-section or vaginal delivery? Were you breastfed? Were you bottle fed? Because those things affect the microbiome. What kind of home life? Were you under stress? Did you have trauma? Did you have, an alcoholic parent? Any of those things, those all frame your immune system when it's in training 0 to 2 years old and then 2 to 18. And the incidents 0 to 2 are far more impactful traumatic wise than 2 to 18. So I actually do ask if they have any memory or any incidences in, early childhood separation from their mother or microbiome insults or whatever. And then we talk about environment. And a lot of times it comes down to maybe they moved homes, maybe they had a water leak in their house, or those little clues will tell me to dig deeper. And then I'm asking about occupation, exposures, hobbies, because all those things might have, say someone's a jeweler and they're using some chemical to clean silver. Well, then I want to think about that chemical and their toxic load. And then what we'll do is test. And we do gut testing for the microbiome. I want to know everything about that microbiome because that affects the gut, the heart, the brain, everything. It's its own individual ecosystem. I want to know about organic acids and things that their body's producing so I can kind of play around with what's too much, too little. Is there dopamine? Is there norepinephrine? Is there serotonin? Is there melatonin? So we know neurochemistry. Hormones are huge. So we do testosterone, DHEA, estrogen, progesterone, all of that. We do metabolic testing. So we do a ton of labs. We do a stool test for the microbiome. We do hormone testing. And then if there's any suspicion of infections, I can do a whole panel of viruses, bacteria, different dormant infections and see. And then when they come back in, I have all this data, usually a stack like this much of information. I put it all together. And what people, I think, really appreciate and what I love to do is I love to tell their story. So they've come in with, I have headaches and brain fog and, numbness in my toes. I'm just making this up.
Sure.
And we do the testing and then they come back in and I look at all the data and I say, oh, well, in 2018, I think this might have had an effect on this and this level is high here. And I tell the story that explains why they're experiencing what they're experiencing. And then I give them a roadmap to go backwards and reverse, if possible, those symptoms. And people are so excited about that because they know there's something. They know, you mentioned, a lot of people know there's something wrong. Intuitively, like, I don't feel my best, but I don't know how to figure it out. So I'm their detective, putting all the pieces together and laying out the landscape and literally retelling their story. And I'll check in with them, like, I think this might have affected you. What do you think? Because people usually know intuitively if I ask the questions, do you think that growing up with an alcoholic father affected your safety? And like, yeah,
Yeah, it's
that's
like giving them the permission to make the connection. They've never really even thought about
and
the
think
connection.
about this, autoimmunity, right? Autoimmunity metaphorically is attack of self. So there's usually an issue there of some safety issue because your body's attacking itself. It doesn't feel safe.
Okay, so then we get into like the environmental toxins
Yeah.
side of it, because you were talking earlier about how you really can't heal until your body feels safe to heal. And there's so many environmental stressors
Yes.
all the time. And EMF is one of those things that I talk about a lot, but people really don't think about. That if, okay, throw the thousands and thousands of, research papers that are out there now aside. If you just think, okay, our body's electrical, we're an electrical being, every cell is electrical. And now we have cell tower here, cell tower there, 3 Wi-Fi points in here. Everyone has a cell phone. We have AirPods. We have Apple Watches. We have the Aura Rings. I mean, the amount of devices in an average, in a room, if there's 10 people, it's probably like 30, and those are all communicating with each other all the time and passing through us. So just on like a very common sense level, that has to be causing stress. And then on top of that, we have air quality, we have water, we have the mold. So where do you start when people, like, I know that you hear, which we should talk about, is like the EMF-friendly space is not the first thing that you did to provide a safe space for people to heal. But can we walk through those kind of like basic, okay, if your bucket's overflowing and you can't come get all of these tests, what do you do? What do you start? What are the starting points?
I love this because I keep it so simple. And even if I'm lecturing to physicians, because physicians too, I remember the very first lecture I heard, Bob Roundtree, my colleague formerly, about toxic load, and it's overwhelming and it's terrifying, right?
Yeah.
So how do we keep this in a way that you know what you need to know, you fear it in a small way because we need to fear it to take action, but we also make it so doable. So I always start with, like I said, even if I'm teaching doctors, clean air, clean water, clean food, and then clean mind and clean body. And so we can talk through clean air is huge. 80% of our toxic load comes from the air that we breathe. So if you're not thinking about your furnace filter, changing that frequently, getting maybe a standalone HEPA or VOC filter. We have 5 here in the office. That's one thing.
That's really amazing.
And at home I have 3 in a small 1,400 square foot condo. And then clean water, making sure we're drinking clean water. A lot of times it's contaminated with chemicals, and even plastic water bottles aren't the best way to consume it. And most of us do when we're traveling and stuff. And so getting that water clean, and ideally a house filtration system. If you can't get a whole house filtration, at least a fridge filter. So I talk about clean water, and then clean food and making sure we're making clean choices in the things that we put into our body. That alone is a detox program. Like that alone, you don't have to go to any great lengths to start there. And then we talk about EMF, this invisible thing that affects all of us every day, all the time. I shared a little bit earlier about how in my own bedroom, I had a building biologist who comes and tests EMF. In fact, I have a very high quality, like 3,000 meter in my desk right there to check EMFs. So I can check radio frequency and stuff. So I actually often will show people, real quick example in my house. I love my Sonos. It's a wireless sound and really, really good sound integrity. It was the highest emission of anything in my house. So I need to wire that and not let it, but it's one of those things people are like, oh, it's a sound system, right? Well, that from my house, my condo was emitting by far in the millions of the high levels of radio frequency. I'm not an expert in physics to describe, just to know it was high.
Yeah.
But
you're like, that's red.
It was high. It was like,
red is bad.
really high. And as I had the building biologist, what I realized is when they turned off the breaker to my house, my body voltage was 300 lying on my bed, which is pretty safe. As soon as they turned on the voltage, it went to 3,000. And I literally at that moment, I didn't normally feel palpitations when I'm sleeping, but when they did that experiment, I could feel my heart change. And I was like, ooh, that's real. It was so profound. And this was years ago. It
That's
was so profound that I was
amazing.
like, there is an issue. We need to think about this. And most people are swimming in that toxic soup. So whatever level of EMF, dirty water, dirty air, they think that's their norm.
Yeah.
But as we perform better and want this optimal performance, all of a sudden we can feel so much more amazing. And when we feel better, as you did after the mold and after your pregnancy, all of a sudden we're like, wait, this is the new standard. This is how I want to feel, right?
I'm chasing this
Yeah,
now
yeah,
from now
right?
on.
Yeah, yeah.
Exactly. I love that. Okay, I want to talk. You were telling a story earlier that I want to retell
Sure.
because it's a good introduction to, because I think that, you're talking about clean air, you're talking about clean water. When you add in the EMF aspect, it can get really scary.
Yeah.
Because you're talking about something you don't really have a choice in. You have a choice on the types of water you drink. You have a choice on the food you consume, the kinds of supplements you take. You have all of these decisions that you're making every day. But EMF was one of those things that just kind of happened. It was like one day we just woke up and everybody had a cell phone.
Yeah.
And Wi-Fi tower or cell towers are every couple hundred feet because the faster bandwidth, the closer they need to be together. And, you look around, you see them painted as palm trees. You see them like painted as bricks. And they're just part of our reality now. And that's super scary, especially if you are really sick and trying to heal. So if you're coming in and now you're introducing, okay, well, I'll start from the very basics, clean water, clean food, all the things, and also going into EMF. You can't walk around in like a Faraday bubble.
Yeah, no.
Right? It's unrealistic.
I've tried. It doesn't work.
Yeah, it's unrealistic. Exactly. So I want to talk about that because I think that's the first thing that people try to figure out is like, well, what do I do?
Yeah.
And they try to get like the silver beanies, for the babies. And then I did all the things. I got the rocks, the bags of rocks that go under and I got the grounding mats and I got I literally tried everything. And then at some point was like, I'm going to be chasing this forever if I don't find something that just gives my body the resilience to live in the world we are in right now.
Yes.
And that's how I kind of found Aries.
Yeah.
And it was like a total game changer. But let's talk about blockers because you had a really great story that I want to hear.
It's so funny. This is how I live life. Everything from cancer. I experience these crazy things. I'm like, oh, that makes sense, right? Like I learn it from experience. So I was asked to speak in Australia at an environmental medicine conference. I was so excited. I'm like going to Australia, Sydney, amazing. But it's a long flight and I don't do great with like travel and stuff. So I always take my own food. And so I'm researching. I'm like, okay, that's a lot of time, 16-hour flight in a metal tube. We know there are high EMFs in a plane. So by nature, you have atmospheric radiation. So the closer the pilots, the staff, they all get higher rates of cancer because of the atmospheric radiation. So if you're someone who flies a lot, you have to think about that. So that's radiation. And then you're in this tube with Wi-Fi and it's metal and it's bouncing off. You're getting a high density and all the people with their cell phones, right? I mean, you have this massive quantity of EMFs. I knew that.
Yeah.
So I'm just like you, I'm online. Okay, what could I do? I find these silver blankets. I'm like, oh, that's amazing. I can cover myself with a blanket. I can sleep all night. I'm going to be all set. So I bought the silver blanket, brought my food. I'm all set. I lay down to sleep. And I wake up about 6 hours into my nap on the flight. It's a 16-hour flight. And I'm in so much pain. Like every joint in my body hurt. And I was like, this is horrible. I don't know if I've ever been in this much pain. Something is really, really wrong. And my thought was, oh, I just can't fly these long flights. This is so bad for me. Not thinking about my blanket. I get to the conference.
I love that you're going there to get the answer.
To get the answer.
Yeah.
And this well-known Dr. Nicole, she's a naturopath in Australia, very well known for building biology. I think she wrote Healthy Homes. Brilliant, hilarious, foul mouth.
Wait, say her name again.
Nicole, her last name is hard to pronounce.
Okay,
we can
I
get
gotta
it,
look
but
it up.
yeah. Healthy Homes is I think is what she
Healthy
wrote.
Homes. Okay.
But so she's lecturing and she's talking about all the details on building a home and safety and EMFs. And she says, tin roofs sound like a great idea. You're protecting yourself from everything coming atmospheric, maybe tin walls. She said, it's the worst idea in the world, unless you have no Wi-Fi devices in the house. If you have anything, a cell phone, a router in that house, it just bounces and you're getting this radiation for yourself. And it hit that moment. She said, I'm like, holy cow, I just created a tin roof on my body in the plane. Duh. I'm like, how stupid was that?
Yes.
And so on the way, so of course that was obvious. And it's interesting because it's like you mentioned, all these devices, there's tons of them on the internet, beanies and this and that. But so even if I would have wrapped myself all the way around, there's still my feet and my head.
Yeah.
It wouldn't have worked. But I packed it in the checked luggage and I was so fine on the way home that I was like, okay,
that is so Crazy. Mike Bender, the one I was telling you about
Yeah.
before, he's the one who really got me thinking about it, because he was talking about how it, like the gloves, he would just travel
Yeah.
up his
Yeah.
arms and
Yeah.
things like that. And I'm like, then there's like the other side of it where it's like, okay, if you're putting this silver beanie on a baby's head,
Yeah.
well, your baby's brain has an electromagnetic field. So now are you blocking, their
Yeah.
natural electromagnetic
Yeah.
field from? So it's just a really
And
interesting
who knows, but I agree
thing.
with you. I really had a change in my Australia trip. I was like, oh, I joke. I'm like, I almost electrocuted myself on my way to Australia. And not that that's physically accurate because I'm not a
Yeah.
physics, but it was.
I think that like the conversation can be had that there's like a place for everything,
Yeah.
like,
Yeah.
okay, I get this, the blanket over the belly, or, things like that.
Yeah.
There's definitely a place for all of it. But whenever Aries came into my world, especially at the time where I was
Yeah.
like, okay, this is significant. I really started to notice that my body, like I started to notice my own sensitivity. And so I was like, okay, this is cool to have something that I can be like confident walking
Yes,
around
yes.
and not like be afraid to go to cities
Yeah,
and,
yeah.
because it's just so hard not to get wrapped up into the fear of electromagnetic frequencies when you really start looking, especially as a mom with children. Do you treat children here?
I do.
Do you have the conversation about EMF with?
Yeah, we do.
Yeah.
We absolutely do.
Yeah.
And I mentioned before, like I have one of these right in that drawer, so I'll often have it sitting right on my desk beside, and patients are like, "What is that?" So it kind of brings up. I mean, it
That's so
helps me because
awesome.
it just feels good. I have my laptop, and before, no, see, there's a Sonos that's actually unplugged back there, but I really have done a lot of EMF mitigation before you guys came to certify this with just the different things and like having your devices by my desk.
That's so awesome. Yeah, I the thing I've always thinking about is like, okay, because I didn't really start paying attention to EMF until my son was born, and I told you my story about my son last time. But they are being like exposed from utero.
Yes, for sure.
So I'm like, what is this going to look like decades from
And
now?
really, the data Nicole presented this on cell phones. 2012 was when the smartphone really took off as far as the amount of radiation. And if you look at data for glioblastoma and certain tumors, it's so closely related to that 2012 and on. So think about that. We're 2025 at the time we're recording this. That's 13 years. It's not that much time to see this effect. And so what you're saying, I think, is going to be, as a medical doctor, I am a little scared to see what 10, 20 years down the road is going to show, because we're just throwing into our environment exponential increase in usage of EMF emitting devices.
Yeah. I have this, I would say, loving debate with people all the time, because they always say, well, there's no research indicating 5G is harmful. I'm like, but here's the kicker.
Yeah.
There's research indicating that 2G is harmful.
Right. Yeah.
And we're talking like, low level gigahertz, high level megahertz. Now we're talking 5G is 300 gigahertz, highest. And that's like, we're talking about millions of times different bandwidth. So I'm like, that's what I was trying to get to earlier, was like the common sense aspect of that. And then it's like, okay, well, we can even have the argument that there's not enough studies regarding children. It's like, well, that would be, we can't really do that.
It's unethical. It's the same as mold studies. We talk about it all the time because we have more animal studies than human studies. It is unethical to put a baby with EMF or to put a human with mold. It's unethical.
Right.
So the research would be purely unethical to do.
But how would you, like, what is your, from your perspective, how do you conclude that this would be more harmful for children? Because that's my own take of it. But how do you get there?
Well, obviously, head size compared to the body is so much larger. And so even just like say they're having a cell phone near their head, there's a lot more space to be affected. And just surface area is smaller.
Yeah.
So you're getting more. So say there's a quantity of EMF exposure to that surface area. It's going to be larger based on their smaller surface area.
Yeah. So like if we have studies saying, okay, EMFs can pierce the blood-brain barrier.
Yeah.
And we know the baby's blood-brain barrier
Isn't
is
fully
thinner or
developed,
not fully developed, then okay. I don't want those studies.
Yeah.
We can decide to do something about that now. Okay, so what are you doing now? I know that the last time that we talked, you had a book, which is here, Unexpected. And you were just coming out with a film.
Yeah.
Can you talk a little bit about the film?
Sure. So it's been really a neat project because it was the year that we were going to release the book, and it was the year we were locked down in pandemic. And I knew that my thought was that morning was like, gosh, is anybody reading books anymore? Because Netflix was a big thing. And now, of course, it always has been, but it was even more so. So I thought, if we really want to change the world and impact, we need to be on screens. I don't know anything about making movies, but I do believe in big projects and dreams. And I thought, why not? So we ended up getting together a team, getting the funding, and over the next 18 months, we filmed. And we ended up filming a lot around my story, which was just interesting in the sense I've been through cancer and Crohn's and mold-related illness and lots of different things. And then we also journeyed with 3 of my patients, one with breast cancer, who was in remission once we were done filming, and 2, one with Lyme disease, and another man with mast cell activation and Lyme disease. And we kind of follow their journeys. And so it was really, really interesting to film. It's called Doctor Patient. And now it's available on Amazon Prime, and it's available on YouTube and Tubi for free with commercials. So it's pretty out there. And it was just really an interesting thing to film these stories of patients and then also just share my own story at a really emotionally impactful level. And what we didn't anticipate was we talked about cancer and Crohn's and Lyme disease and electromagnetic frequencies and environmental insults and toxic load and all of this stuff. But at the end, we really go deeper with relationships and healing the inner child and some really profound things that I think are next level healing. Because you can do all the functional medicine in the world, but if you have an old trauma you've not dealt with, or you don't feel safe in your body, which is where we started, that's going to take you to the next level of healing. So we really, really dive into all those deep concepts in the movie.
Okay, well, I have to say personally that I really, really appreciate what you're doing in the world, because it's so hard right now to find a doctor. I mean, as a mother with my kids, like, I get emotional thinking about it, because it's like, it is so hard to find people who are really thinking this all the way through of like, and now it's so normal. I was talking to the videographer about this today of like, it is so oddly normal to have a kid that has autism, autoimmune, diabetes. I mean, like, the conversations, it's just like everyone's just accepted that this is like normal. That the majority of children in school are going to have something that they're dealing with. And then there's so many cases and so many situations where they don't know where to go. They don't know where to start. And I really appreciate your take, because it's like, it's not just one thing. It's never one thing. And there's not really ever just one solution. There's all these different factors that you have to think about. There's your history that you have to think about. And I love that you are kind of setting a new standard, not just even with your space of like, you're setting a new standard for medical professionals with your space. I mean, you're EMF-friendly, of the clean air, the clean water, all of these things that are so important. The lighting, even the lighting in here, to like allow your body to settle and rest in and like really start to heal. That standard is so high now because of the things that you're doing. I mean, it really is amazing. So thank you.
You're
From
welcome.
just a mother that is like, I wish I had this next door, you know, I wish I had this in my own town. So that's really awesome. I would love to know what your advice is to other medical professionals who are trying to build the bridge the other way. I know that you built the bridge from kind of the more holistic side or functional medicine side to, is it allopathic?
Allopathic medicine.
Allopathic,
exactly.
But what would the advice you would have for people coming the other way? Where would they start?
Yeah, this is so interesting because, again, when I was in medical school, I mean, you know, you have this medical school class and you get together and you know everyone really well, and then you graduate and you kind of keep in touch. It's like a high school grad, you know, in a way. And so a lot of my colleagues kind of thought, I don't know what Jill is doing. She's a little bit weird out there, but whatever. Well, it's been neat because even if they thought it was a little bit out there with my thoughts on, you know, chiropractic, acupuncture, massage therapy, or other integrated therapies, what's happened over the years is, you know, one of them's son started to have a seizure disorder. Another one's mother had autoimmune. Another one's father developed dementia. And in these complex chronic diseases, what they're realizing is, oh, I'm limited in my scope with allopathic medicine. The drugs for Alzheimer's don't work. Or my autoimmune disease, they're wanting me to do a biological agent to shut down my immune system. But isn't there something else I could do? Or the son with seizures, they tried all these seizure medications and nothing would control the seizures. And I could give you a dozen other samples of situations where a colleague who went to traditional medical school realized the extent of their knowledge was limited. And that's when I would get these calls and be like, oh, you know what, Jill, I knew you were doing weird stuff back then. Do you have any solutions, right? And you know, the biggest new patient in my practice is another doctor. Like the most common patient I see is another colleague here. So probably 30% of my practice is other physicians. And I don't always say that, but it's important to me because one of the things I know is I can only see so many patients every day, and I'm at my limit. I love seeing patients. I'm not going to stop.
I heard your
Long wait
assistant
list,
talking
yeah.
like, hey, it's going to be a
Yeah.
6 months run.
So we have that, and I'm doing as much as I can do day to day. But what I know how I can make a bigger impact in the world is if I can teach the teachers and train the physicians. So I have really gone into that the last decade of teaching doctors, because there are more ways. And when they have more, I always say conventional medicine gives you this toolbox that is wonderful. With functional medicine, we have a larger toolbox. We have more things to use to help you get well. So what I like to do is inform them and help them understand there are so many more things out there they can do, and really just empower them, because as soon as they feel empowered, most of them, if they really understand root cause, functional medicine, biochemical pathways, we all went to medical school and learned the same thing. And if they realize the power of that, nutrition and diet and lifestyle and EMF mitigation and all these things, they are empowered to go and make that change in their own practices. So I get really excited to teach and train physicians and kind of open their mind to think about the bigger picture, which is conventional medicine is perfect. We just want to expand it. It's not, I should say perfect, nothing's perfect, but it's good. We don't have to throw the baby out with the bathwater. We just expand our thinking and become critical thinkers, problem solvers, and pattern recognition systems. And when we do that, we can find the solutions to very, very complex problems that we never knew existed. It is all about projecting that trajectory and saying, where are you at in this trajectory? Where do you want to be? Where are you at now? How do we get backwards? It's creating a map. And that map involves diet, lifestyle, nutrition, environmental inputs, detoxification, treating hidden alcohol infections, calming that immune system, decrease inflammation. And we're taught in medical school drugs and surgery. They work to a certain extent. But when you look at this big picture and you think about all the other tools that you have, there's a lot more that can be done.
I love that you're talking about adding more to the toolkit. You're also talking about like the view, like, you know, and a lot of things you go and they're looking at this one thing and they're treating this one thing, and it's like all of a sudden you're like, whoop.
Yeah.
You know, like it's just like taking a drone like so much higher of like, okay. But I also like what you're saying of like, it's actually a lot less scary when you realize there's so many things you can do.
Yes.
Like there's so many different, like, you know, EMF protection, water, like all of these things that you can start right now.
Right.
You don't, you know, necessarily have to take this pill. And if this pill doesn't work, you're done for,
right?
You know?
Well, part of our old system was very paternalistic. So 50 years ago, you go to the doctor had all the knowledge, and he'd say, take this pill, and you'd take the pill. There was no empowerment for the patient to say, what role do I have? I'll never forget, I got diagnosed with Crohn's disease 9 months after I finished my cancer treatment. And I went into my gastroenterologist to kind of say, what is this deal? What do I have to do about it? I'm asking him all these questions. He's like, Jill, this is lifelong. There's no cure. You're probably going to have part of your colon removed during your life. Best treatment is steroids and biologics, and this is incurable. I was like, oh, great. And right before I left, I asked one question, and that was, doc, I want to do whatever my part is. What diet should I do? What does diet have anything to do with this? He did not even pause. He said, Jill, diet has nothing to do with this.
Oh.
And I remember thinking, I was only a third year medical student. I didn't know any better. He could have been right. But I was like, that can't be right. Our gut and diet doesn't have anything to do with it. And I went on a search to prove him wrong. And I did eventually. I'm completely cured of Crohn's disease. It started with diet, then changing my microbiome, and then looking at any dysbiosis. But I'm saying that because in that moment, I became empowered and thought, what can I do? It's not a pill. It's not a prescription. It's what empowerment do I have? And the more power we give to our patients with things that they can do, that they own, that's where healing starts, not some pill or some procedure. Those can be life-saving measures at certain times, but the true empowerment is where we get the change. And when people know that they have ability to make a change, that's true empowerment.
And they just feel that they only need that one subtle difference. They feel that one subtle difference, and they're like, this is working. I can keep moving forward. Yes. That's amazing. Okay, well, can you tell everybody where to find you?
Sure. Yeah. So my website is jillcarnahan.com, JILLCARNAHAN.com, and you can find the movie there, the book. Dr. Jill Health is the retail portion, and I have literally 15 years of blogs and podcasts and tons of free resources if you want to know more.
Definitely go watch the documentary, and if you haven't gone to listen to the first episode we did where she tells her story, I didn't want to get into it again because I wanted to get more information. I'm like, I feel so lucky to be here with you. But guys, go listen to her story. It's so incredible. You're such an incredible person, and I feel really grateful to be able to have this conversation with you. So thank you so much.
You are so welcome.